Let's see about the causation of labor. For that, we first need to know what labor is. Labor is a physiological process in which the fetus, membranes, umbilical cord and the placenta are expelled out of the uterus. This is labor. Now coming to the WHO definition of normal labor. Normal labor is different from labor. So normal labor was defined by WHO as should be spontaneous in onset, low risk at the start of labor and remaining so throughout the process of labor and after delivery. The infant is born spontaneously in vertex presentation between 37 to 42 completed weeks of gestation and after birth the mother and the child are in good condition. This is the definition given by WHO for normal labor. And if the labor occurs at less than 37 weeks, then it is said to be preterm or premature labor. Now let's see some details about the uterus. Uterus, as we all know, is made up of 3 layers. The outer serosa, middle muscular layer and the inner endometrial layer. The outer serosal layer is in turn made up of 3 layers, which are the vascular layer, which is near the muscular layer, then the secondary layer and the outermost will be the longitudinal layer. So this vascular layer contains many blood vessels as the name indicates, and the secondary layer is continuous with the uterine ligaments. The longitudinal layer has longitudinal fasciculi which are continuous with the longitudinal layer of the fallopian tube. Then the middle muscular layer, there will be outer longitudinal smooth muscles, middle crisscross layer of smooth muscle and inner circular. So the muscular layer is entirely smooth muscle. Outer longitudinal, inner circular and middle crisscross fibers. And these crisscross fibers act as living ligature. The contraction of this crisscross fibers leads to prevention of postpartum hemorrhage. So what happens is, during labor and just before the onset of labor, The uterus is divided into two segments, the upper segment and the lower segment. The lower segment is nothing but the isthmus of the uterus, which gets dilated, forming the lower segment, and the isthmus is the portion between the anatomical and histological internal os. And during uterine contractions, what happens is the muscles in the upper segment contract, thereby they get shortened and thickened, whereas the muscles of the lower segment start relaxing and they lengthen. So the upper segment is shortened and thickened, whereas the lower segment gets elongated and it becomes thin. And the junction between the two, the upper and the lower segment, is called the physiological retraction ring. There is nothing but a ridge which marks the junction between the upper and the lower uterine segment. In case of any obstructed labor, there will be thickening and prominence of this physiological retraction ring, forming pathological retraction ring, which is also called as Bandel's ring. Coming to the topic proper, that is the causation of labor. There are three main factors leading to the causation of labor, which are role of prostaglandins, then the uterine distension, and the mechanical irritation. First, let's see the role of prostaglandins. So, according to the theory of fetus, amniotic fluid, fetal membranes, and decidua complex, it is considered a metabolically active unit. So, this transmits signals that lead to the onset of labor. The prostaglandin synthesis takes place mainly in the amnion, chorion, and the decidua. From the arachidonic precursor, and the prostaglandin synthesis is very important for labor. And coming to the actions of prostaglandins, they help in formation of gap junctions in the myometrium, then they cause active uterine contractions, and it also causes cervical ripening. Cervical ripening is nothing but increasing the flexibility and softening the cervix by degrading all the collagen and protein. So, that is cervical ripening. First, formation of gap junctions. Next is activation of contractions, and the third is cervical ripening. Cervical ripening is induced by prostaglandin E2 and F2 by activation of collagenase. Next, the fetal cortisol also plays an important role in labor by the hypothalamo, pituitary and adrenal axis. This is about the prostaglandins. Next, the uterine distension. After a certain extent of uterine distension, like in any other organ, it tends to contract and empty itself. After attaining a certain limit, so this is nothing but at term the uterine growth decreases and the fetal growth increases. So there is increase in intrauterine pressure, due to which the uterine muscles start contracting and they try to empty itself, thereby initiating labor. Next is mechanical irritation. This is due to stretching of lower uterine segment by the fetal head is one of the important factors for the causation of labor. So these are all the important points about the causation of labor. Thank you.